Hey folks, I have had a couple of conversations here lately with people who are wondering why the kettlebell swing hurts their back. Now, typically when I have these conversations, the first question that I have for these folks is, are you actually performing a hip hinge movement, or are you trying to squat your swing? And there's an important distinction there. With the hip hinge, your backside, your hips are going to move more horizontally, so your hips are going to move back with a kind of a slight knee bend. With a squat, your butt is going to move more vertically with a pretty deep knee bend, okay? And both of them are good. They're both important patterns. You should do both of them, the hip hinge and the squat, to the extent that you can. But they are different movements, and so you want to apply them differently. So just so you can see that in action, the swing, which is part of the hip hinge family, we're here, we're going to load back into the hips, the back is straight, we're going to hike the bell back, drive hard through the heels. Bell's going to float out in front and back down again. You can see I'm not getting a whole lot of bend here in my knees. Most of the movement is coming here in my hips. Sorry, I needed to chalk up just a little bit. Sit back into the hips. That's your swing. That's part of your hip hinge family. Again, sit back into the hips hard, slight knee bend. Very different from a squat. Squat is going to be more up and down. I hope you guys could see the difference there, because that's a heavy bell and I'm not doing that again. The second question I want to know from people is, how are you breathing? Okay? As you can hear in my voice right now, how you breathe and that you breathe is pretty important in that swing. So what I typically instruct people on doing with their breathing: inhale up at the top, hike the bell back. As the bell comes up, quick exhale, breathe in again, let the bell come back down into the swing, so you're loading up into the next rep, drive back up, exhale, breathe in again, bell comes back down. So you're doing this fairly quickly. You're not getting very deep breaths with this, primarily just because you just don't have time. So I'm going to do that again with the bell so that you can actually hear my breathing through the swing. Big deep breath. Brace. Park the bell, and you're done. The reason I breathe that way, the reason I teach people to breathe that way, is because at the top of the movement, when you are tall, you literally have the most room to breathe. You're standing upright, your diaphragm can drop, your lungs have plenty of room to breathe, or plenty of room to expand rather. The more air you can get into your lungs, the harder a brace you can kind of form around your trunk and your midsection. If you try to inhale as you're coming down, those viscerals, the GI tract, the intestines, all that kind of stuff is getting pushed up because of how you're flexing, and your lungs literally just aren't going to have as much room to expand. So breathe in at the top of the movement, quick sniff in, hold that breath as you sit back into your hips, and as you extend that bell back out, quick breath out, and then rebreathe again, okay? That kind of leads us into the third point, the third question I'm going to ask folks is, are they bracing at the top? And what I mean by that is, at the top of the swing, when that bell is kind of hovering, floating for fractions of a second out in front of you, you should be braced all the way through your body. It's kind of like a plank when planks are done properly. And what I mean by that is a plank done properly is it is a full body tension exercise. So you're squeezing your quads, the front of your thighs, you're squeezing your midsection, you're clamped down on your butt, you're gripping that bell hard. Every muscle that you can possibly squeeze is contracted at the top of that swing. And part of the reason that we do that is because the bell itself wants to project away from you, right? So we're using that brace to kind of root ourselves in place so that bell doesn't kind of jerk us forward and pull us out of our position. Okay, so I'm gonna do this one more time. Reach out, you'll take the bell, hike it, drive hard, and as that bell wants to go that way, tightening the thighs, clamping down with your butt, bracing your midsection against that big lung full of air that you've got, gripping the handle hard. Now, there's three different things here that I've given you to work on. One, are you actually hinging? Two, how are you breathing? And three, are you getting a good brace at the top of the swing? Because of the ballistic nature of the swing, because the swing moves so quickly, you don't have time to think about all those different things. So what I want you to do going forward is during each set, I want you to pick one thing. Are you really getting back into your hips? Are you really hinging well? Do you feel a little bit of a stretch in your hamstrings and your butt at the back end of the swing? And focus on that for the entirety of the set. The next set, okay, let's focus on the breathing. Are we breathing, getting that big breath in up at the top before we start? And then are we firing out that little breath and then sucking that air back in really quick at the top? Then on the next set, let's focus on the bracing. Because again, you don't have time to think about all those things during the course of a swing. You just don't. So take an opportunity to kind of pull it apart a little bit and work on each individual piece. The more you practice those individual pieces, the more they're going to become just kind of second nature for you, okay? So I hope that was helpful. And remember, if your back is bothering you, go see a medical professional, okay? It's not our job as trainers to try to help you heal an injury. It's our job as trainers to try to help you move as strongly and as efficiently as possible. But if there's something going on from a pain standpoint, have it checked out by a licensed medical professional. There are a bunch of great PTs in the area. I'm going to give a shout out to Susan and Chris Peterson, who are literally right down the street from us. There's OSPT up in White Plains. There's a lot of good physical therapists in the area. There are also some good chiropractors in the area. Dr. Jess Crawford and Liz Rand up in Waldorf, they're good. I've heard great things about Winter's Chiropractic. I have never been on a table with any of the guys over there, but again, I hear good things. So if you have an issue that is not going away, don't go to your trainer. Go to a licensed professional, get them to fix it, okay? And then come back to us and let us diagnose or dissect how you're moving and see if we can fix that, okay? I'd love to hear your comments on this. Hope you guys have a great night.